Welcome back to the next video, which is for the module Spinal Assessment and Management. We're talking about yoga and various different postures within yoga. So normally with regard to back pain, we've got two types of dysfunction. We've got people that struggle to bend forwards and people that struggle to arch back. So the most common is the flexion dysfunction, and the less common is the extension dysfunction. Flexion dysfunctions are commonly associated with discogenic and neurological pathology. Extension, arching back, is more associated with the facet joint and maybe some sort of arthritis, inflammation of the joint. So we've got these two opposing movements that we need to do. Now, yoga is really good because we will fluctuate between extremes of flexion, which is normally a little bit safer, and then extremes of extension. So the whole idea is getting your patient to go from spinal flexion to spinal extension. And let me show you what that looks like. So if you join me down on the mat, I'm going to go into child's pose. Now, child's pose means that I'm basically in this position here, like that. Okay, and what it is this is global spinal flexion. So my spine is maximally flexed when I'm in this position. Yeah, so that will be quite comfortable for some people, might be less comfortable for others. And then the opposite of that is global spinal extension. So here my spine is fully extended. Yeah, this will be uncomfortable for some people. What we want is dropping down of the hips as well. So we've got these two postures that we need to work on because our patient will struggle with either spinal flexion or spinal extension, but normally both. So the whole idea is that we begin to articulate the spine in these two positions. So we're going to start in 4-point kneeling, making sure that the hands are stacked under the shoulders and the knees under the hips. Okay, and all we're doing is what we call cat and cow. The cat position is this, where we're arching the back, creating spinal flexion, and the cow position is this, where we're looking up and sticking the bottom out. And we're just alternating between the two. Yeah, now yoga is about combining the breath work. Okay, so normally you'd be breathing in on one and out on the other, but I want you to breathe out on both. And I'll show you what I mean. As you breathe out, you're going to contract the spine up, draw your belly button to your spine, arch your back as much as you can, and then just let it go. And then you breathe in to prepare, breathe out, and then as you breathe out, you look up and stick your bottom out at the same time. This movement will produce global spinal extension. Okay, we've got two movements happening here. We've got movement of the spine, we've also got movement of the pelvis. So between the cat and the cow, we've got spinal movement and pelvic movement. After we've done the cat-cow movement, we then move on to isolated pelvic tilt. Okay, isolated pelvic tilt is we squeeze the buttocks, tuck the pelvis under, relax, okay, and then push the bottom out. So we're arching the back, creating a lumbar lordosis. Tuck the pelvis under, posterior pelvic tilt, back to neutral, and then stick the bottom out, anterior pelvic tilt. Okay, so what this is now doing, it's a dissociation movement between the spine and the pelvis. Very important that spinal patients learn to dissociate between the pelvis and the spine in terms of movement. Once we're happy getting into those movements, we can then go onto the tummy and then start to progress, very similar to the Mackenzie push-up. So if we lie on our tummy, hands by the shoulder, okay, feet together, and all we're doing is gently extending up, okay? And this is known as Cobra, like you're like you've got one leg and you're coming up into this position. This is working global spinal extension. And then eventually from this position, we can come up into a Sphinx position, keeping the rib cage down on the mat. We don't want to be up here, okay? We want to be here, okay? By being in this position, we're working a bit more in thoracic extension than lumbar extension. We all know that thoracic extension is always limited. So we're just working in this position, and we might bring the hands in a little bit and start working higher using the arms to work further and further, elbows lifting off into that extension movement. Slow progressive desensitization to global spinal extension, so that we've got those two movements here, global spinal extension, and then we come hands back into global spinal flexion. And then we can just move between the two, extension and flexion, extension and flexion. When we get better, that will then progress from what we call downward dog to upward dog. So this is the progression. We would start in the downward dog position, arms are stretched out, heels flat, and we stick the bottom up. From this position, we then transition down into a negative push-up and then push forwards into this upward dog position, global spinal extension, okay, and then back in to downward dog. So that is the posture when it's more advanced. Okay, global spinal flexion, global spinal extension. That's what we're after here. Now it's your turn. Let's do some practical and have a go yourselves.